Hi everyone, my name is Bonnie Guier and I'm going to be doing the presentation on mindfulness today for you. So I love mindfulness and we're going to dive into what that is, what that looks like, and how it can help you and your dog in the realm of service dog handling. First, I want to say I'm super excited to be a part of the very first online service dog handler symposium. To me, that's really exciting because sometimes these resources maybe there aren't very many of them or there may be a hefty cost involved. So I'm super excited to be a part of this that's free for you. This symposium is for current as well as aspiring service dog handlers, which I think is great to help folks that maybe haven't had a service dog before or are just kind of exploring what training looks like to have an idea of what's involved in that. Second, I want to thank Penny Beeman for organizing this event. She's taken a lot of time and shared her talents to make this possible. And I appreciate her allowing me to be a presenter for you and including this topic. I wanted to share just a little bit about myself. So, I am a licensed clinical social worker in the state of Missouri. I have been in the field of social work since 2004 when I got my graduate degree in social work. I became licensed in 2012. I have not been in practice for about 4 years now. I started my dog training business full time 4 years ago. The groups that I have worked with in my social work experience have included foster care. I have volunteered with folks in nursing homes. I've worked with youth in residential facilities. I've been a mental health crisis line worker. I have done evaluations for those in mental health court. So, a wide variety of roles that I have had some experience in as far as the social work realm. My dog training experiences, I have 15 years of formal dog training experience. And that started when I got my dog Bo to be a therapy dog to assist me with my volunteer work. And so that was our introduction to positive reinforcement training, which I'm very grateful that we had that from the start. He sailed through everything, accomplished a lot of different kinds of titles and things that were fun for us, and was just an amazing dog. And I learned so much about how dogs can help their people, especially through service dog and therapy dog kind of work and the skills that they need in order to handle all the different situations that they're put in and that they face. So we're going to dive in next as to what mindfulness is. So I looked up the actual definition because I can get kind of wordy about things, and I thought that would be the best way to make it succinct for those of you that are watching. The definition of mindfulness is a state of being present and aware of one's thoughts, emotions, and bodily sensations in the current moment and without judgment. Okay, so that is the definition, a state of being present and aware of one's thoughts, emotions, and bodily sensations in the current moment and without judgment. This means that, for example, if I am feeling anxious about something, that I allow that feeling of anxiousness to be present and I acknowledge that it is there without pushing it away or rejecting that feeling or the thought, without judging myself. You can't handle this. This is too big, without stuffing it down. That's just one example. Now, it doesn't mean that I have to allow my anxiety to grow out of control, but it does mean that I allow my emotions to be present. And what's healthy about that is when we try to suppress our emotions down and push them away, rather than allowing them to come through, then when they come back the next time, they tend to come back stronger and harder to manage. And that can easily become a subconscious pattern. What that can make it even more difficult to manage because if we're not aware of when the anxiety is starting, for example, it can be harder to implement techniques that can manage that effectively. So the earlier we catch it in the process, the easier it is for us to manage it and be able to kind of go through some of these techniques that can help calm our system, help us refocus, that kind of thing. If we're constantly redirecting and not allowing our body and our mind to unite and face what we're experiencing, then it comes back stronger and harder to manage. So, by allowing and acknowledging our current state of being, this can reduce our stress, anxiety, and pain levels. Distractions can improve our overall well-being and reduce our stress and anxiety in dogs. Okay. So I'm going to give you an example that probably many folks can relate to. If not, that's okay. Hopefully this is thorough enough that that you'll be able to follow along. So the first example is I have a doctor's appointment coming up, and I can notice that I'm feeling anxious about that. The way I would use mindfulness, what that would look like, is I'm going to acknowledge the emotion that is present without judgment. So instead of saying, I'm such a worrywart because I'm anxious about this doctor's appointment and I've seen this doctor 10 times without issue, we can simply acknowledge I'm feeling anxious about my doctor's appointment. That's a very realistic, fair, non-judgmental statement. The second is to acknowledge the thought that may come along with that. So our thoughts might be, is my procedure going to hurt? What are my test results going to be like? Am I going to have surgery? If they adjust my medications, what is that process going to be like? How long is it going to take? If you have anxiety around medical kinds of things, you're very familiar with how fastly this can go down a rabbit hole and kind of spiral. So we want to just acknowledge the feeling that we're having and the thoughts that are occurring, just to notice that they're there. All right. Then we can also acknowledge our bodily sensations. And if at any time you feel like I don't really have a bodily sensation or my body sensation is numb, then that's totally fine. Okay. That is something that you can acknowledge in and of itself. My body is numb. So our bodily sensations that we may notice might be GI upset. So whatever that looks or feels like for you, gastrointestinal, stomach kinds of things, sweating, anywhere that is maybe in excess or not a normal part of sweating for you, muscle tension, anywhere in your body, headaches, holding your breath without really thinking about it or without it being intentional, shallow breathing, more rapid breathing, all right, maybe lightheadedness, dizziness, tiredness, fatigue, or feeling more energy than usual, feeling antsy, feeling edgy, feeling irritable, and just knowing what those things feel like in your body when you experience those emotions. Okay. So that's what we mean by bodily sensation. Sometimes when I am meeting with clients or introducing mindfulness to someone new, I get folks who are somewhat skeptical, especially being in the Midwest. We are kind of skeptical of things that are new, or may feel or sound like they're far out there. Like, what is this? Well, it's not a Reiki thing. It's not an energy thing, which is fine if you're into those kinds of things, but mindfulness is very different. It is a research proven technique to help with many different issues. So I kind of summarize this by saying, is it real? Is mindfulness real? How is mindfulness different than positive thinking? So mindfulness is really being present in the current moment, no matter what it is, accepting all feelings, thoughts, sensations without judgment. This means that we make ourselves consciously aware and reframe phrases that may say, this is a good feeling, this is a bad feeling, I should feel this way. The thought process that there is a right or wrong way to feel about something, we want to move away from that. So, like I said earlier, I'm such a worry wart because I just can't get over that this doctor's appointment is happening tomorrow. I've seen this doctor 10 times. I fully trust them. I shouldn't be nervous. Okay. Those are very judgmental kinds of statements. If we just take a step back and we take the judgment piece out of it, we're left with, I'm feeling really nervous about my doctor's appointment tomorrow. And that's a very valid, fair kind of thought to have. Okay. Next is utilizing curiosity to explore the emotion, the bodily sensation, or the judgment that may be coming along with that. So you can say to yourself when you notice yourself feeling anxious, what is it that I'm really anxious about tomorrow with my doctor's appointment? Or is there a past experience that you or a loved one or a friend or coworker has had that maybe is spiking that anxiety? I'm curious what what's going on with my stomach right now. So it may not always be a thought that happens first. It may not always be an emotion that we've noticed yet. The more you do the mindfulness, the more you will catch on to the bodily sensations that you do have. And for me, those serve as kind of some, just some little flags that like, hey, something's off. And when I had practiced mindfulness really solid with some progressive muscle relaxation for about a solid month, the way I could tell my muscle tension was starting up was much earlier in the process than it was when I very first started to do the exercise. So it's really interesting how attuned you become to your body when you start using these exercises. And again, that just makes it easier for us to acknowledge what's going on, be mindful of what's happening, implement some techniques earlier in the process so that they're easier to redirect. So you could say, oh man, I've got this really hard knot in my shoulder. What's going on with that? Or my stomach is really fluttery today. I'm not sure why. And it gives us a signal to check in with ourselves emotionally, mentally, and see where we're at and where that may be stemming from. Okay. The other thing about mindfulness is because it focuses on being in the current moment, it eliminates past and future thinking. So, for example, with anxiety, most anxiety stems from experiences from the past or worries about the future, even if it's what's going to happen 5 seconds from now, 5 minutes from now, tomorrow, or what just happened 15 minutes ago or yesterday. All right. When we explore the actual anxious thoughts that people report having, those are the two time frames that they typically are happening in. Of course, these I want to say a disclaimer here. This is obviously outside of an emergent or traumatic experience happening. Okay. So I just want to put that disclaimer in there. This is just on, kind of your average day, not in the midst of those kinds of situations. So by focusing on what's truly happening in the present moment, it allows our mind and our body to experience some safety and kind of a little bit of respite because we're not stuck in the past or the future. We're just being present with what truly is right now. And that's how mindfulness can be so grounding, is because it really pulls us to what we are truly experiencing in the moment. It is so effective that numerous Fortune 500 companies use mindfulness. They teach mindfulness as part of their employee orientation and as part of their ongoing, like, continuing education for employees because they have seen such an increase in productivity, overall well-being for their workers, physically and mentally. Okay. So it's a very powerful tool. It's also shown to significantly improve the quality of life for folks who struggle with chronic pain. And when I did my training, I went through like a 3-day training in mindfulness. That was really cool. Um, the presenter talked a lot about the gentleman who really pulled mindfulness into working with chronic pain patients. And although it may not have obviously resolved the root of their chronic pain issue, it did improve their quality of life. And what was reported by the chronic pain patients when they combined mindfulness and some of the yoga poses or whatnot was it allowed them to notice that there wasn't always this pain at this intensity, that there were breaks, or there were at least breaks where the pain was less intense. So when we get stuck in that, in kind of that future thinking, or that ultimate thinking, right? The never and always, it kind of tricks our brain into buying into that and takes away our natural ability to notice those moments on our own. So subconsciously, our thoughts are telling our brain, this is always happening. So then that's what we tend to feel. But when we practice mindfulness, it breaks that pattern. It allows us to stay in the current moment and acknowledge what truly is. And so when people practice mindfulness multiple times throughout the day who have the chronic pain, even if it's for 2 minutes, they can say, I had 2 minutes that my pain was less today. I had 2 whole minutes that I was pain free. And I got to really enjoy that and take advantage of that. So that's an example of how powerful mindfulness can be and how beneficial it can be for different types of folks, even for those who may not have PTSD, anxiety, depression, bipolar, chronic pain. You know, if you want to call it an average person, mindfulness can still be a very valuable tool because we all experience emotions, you know, in our lives. And some of us really struggle with knowing how to effectively manage them. So, next is, why is mindfulness effective? So, I just kind of touched on that a little bit. I'm going to dive into a few more details. By focusing on the present, mindfulness reduces the frequency, intensity, and duration of stress, anxiety, racing thoughts, rumination, and pain. So rumination is kind of getting stuck on that same thought or situation and replaying it in your head over and over and over about what you could have said different, what you could have done different, what if this person would have done this way, or maybe even just the same phrase. That's what we mean by rumination. All right. It shifts us away from the trap of what ifs and the always or never, the should or should not. We call these forms of thinking rigid thinking, and we're focusing instead through mindfulness on what actually is present in the moment. We are also giving ourselves permission to have these feelings. So there's a lot of people who maybe when they were growing up or even as an adult were put in situations where they were told or influenced to not feel a certain way, to not let certain emotions show, that certain emotions weren't okay, to be strong, men don't cry. Those are some examples, right? Keep your chin up. Not to say that those are necessarily always bad, but when that set is like the expectation that that's where the way you must always be, and it doesn't allow room for these other emotions to take place, then it's really creating a stressful situation for your nervous system and for your brain. Because as human beings, we're going to have those feelings. And if we don't face and cope with them effectively, then they just continue to build and progressively get worse. And they can cause all kinds of physical ailments in the body. They can magnify physical ailments in the body, as well as our emotional or mental health ailments. Um, so what we want to focus on again is acknowledging what is present, and without judgment, we can interrupt that cycle, right? So what if this happens tomorrow at my doctor's appointment? What if the meds don't work right? What if they want to change my meds that are working really well? What if it takes me 6 weeks before I can see any results from this medication and I lose my job? Um, I'm always in pain. I'm never able to sleep well. Those are examples of that rigid thinking. And when we can interrupt that thought pattern, because those kinds of thoughts amplify stress, they add stress to us to pressure us to feel something different, right? So I never sleep well. If I'm telling myself over and over again, that's going to make it hard for me to sleep well. And then I'm pressuring myself to sleep well. So it's just kind of this vicious cycle. By practicing mindfulness, we can interrupt that thought pattern and redirect it into more productive things and allow it to truly be coped with and managed and acknowledged. And that allows our nervous system and our brain to kind of take a breath and have some respite. All right. We've talked a little bit about doing that without judgment. So, grown-ups shouldn't cry, or, a real parent doesn't say X, Y, and Z. Using judgmental thoughts only exacerbate the problem. They do not relieve the problem, right? So we may be trying to use that subconsciously as a way to make ourselves feel better, or as kind of an ineffective coping mechanism, but maybe it's the only way we've known how to cope with something is to we've heard that from someone that cared about us when we were younger or an adult. And so we just kind of repeat that in our head. And the problem is that it doesn't alleviate anything. It typically makes the situation worse in the long term. All right. Our thoughts and our emotions have a significant impact on our physical health and the severity of symptoms, in addition to our mental health. All right. So, for folks that I have worked with, especially that have been through trauma that is unresolved on the nervous system level tends to manifest itself in lots of physical ways. And for each person, that's going to look at a little different. It is not uncommon for folks that have been through trauma to experience chronic pain, chronic stomach issues, mood disorders, um, sleep disorders. Okay. So for someone who has been through trauma, they may have a lot of stomach problems because, of course, our natural reaction to protect ourselves is we want to avoid those thoughts and feelings. So we push it away, right? And we haven't coped with it effectively. And our body is telling us there's something here that needs to be dealt with. It needs to get out. It needs to get out. And because we're not releasing it emotionally, at a nervous system level, I'm not talking about like up here where we think it through. I'm talking about like on a nervous system level, at a subconscious level, because our body has not effectively had a way to release that. Then it is now manifesting as a physical symptom to be like, I'm going to make you deal with this. All right. So it's a lot of times our body's way of trying to signal to us, hey, something's not right and you need to cope with this. You need to deal with this. Um, so that's just a little bit of tidbit of extra information about things that I've experienced and that we see in the therapist community when working with folks that have trauma. So by using mindfulness, it gives us a way to acknowledge those feelings. You're going to learn some techniques that can help you today on a nervous system level. And the reason this all comes into play with service dog handling is because our dogs are very attuned to us as service dogs. They can sense our emotions. They know when something is off. They know when something's not right with us, especially physically, but also they're starting to pick up on us socially, right? And sometimes we've trained them to do exactly that. So the more attuned we are with ourselves, the more we can train our dogs to help us, but the more we can also help them in a way. And we're going to go through that here in just a moment. Next, I'm going to walk you through a mindfulness exercise. This includes a few different components. One is deep breathing. So breathing from the diaphragm, doing controlled diaphragm breaths is actually shown to reduce muscle tension, to reduce stress, to reduce anxiety, and really create a sense of calm or calmer. So one disclaimer that I like to make with folks is when you do this exercise and as you're practicing it, you may notice an immediate difference or a big difference right away, and that's phenomenal. That's fantastic. I'm super excited for you. Other people may say, it didn't help me that much, or I can't stay focused that long. So you have to work with yourself individually on maybe this is a gradual process for you. Maybe you do a rating of a scale of 0 to 10 in the beginning. Okay, my stress today is at an 8 before the exercise. And then when you're done with the exercise, maybe it's at a 5 or a 4. The more you practice it, the faster you're going to be able to close that gap and the lower your number is going to get. Okay. I also have had some folks, I typically recommend a deep breath in through the nose and out through the mouth. So we can go in through the nose, down to our belly, and then out through the mouth. So to help you with this, you might want to put your hands on your belly. And as you breathe in through your nose, focus on your belly expanding as you breathe in. So your belly should rise, and then breathe out, and your belly should fall. That's what I mean by deep breathing. Okay. There are a few people, especially if they've been through traumatic experiences, who the deep breathing may actually be triggering and stress inducing for them. So this is very much an exercise that you can personalize to yourself. You know your body best. And I'm not one, nobody, there isn't any therapist or doctor or myself that should be saying, oh no, you have to do it this way. You have to hold your breath for 5 seconds, otherwise it's not going to work. If that is more inducing of stress, anxiety, that kind of thing for you, then do what works for you. So for example, I have a friend who not doing deep breaths, but just doing slower breaths is better for her. So it may take some experimenting to see what works well for you as you practice this on your own at home. Okay. So that's how the deep breathing works. You can hold your hand on your stomach, breathe in through your nose, feel your belly rise, out through your mouth, feel your belly fall. You can do this exercise eyes open or closed. You will see me with my eyes closed because that's how I feel most attuned to my body. I do, when I work with clients, encourage them to close their eyes. But if that feels stressful or anxiety provoking to you, or may lead to like some dissociation or some numbness, then you're more than welcome to keep your eyes open. If you do keep your eyes open, what I encourage folks to do is to like maybe pick a spot in a picture or something on the wall that's just going to kind of be like your soft gaze spot, right? So you're just kind of staring at that one spot and allowing yourself to be, okay? You don't have to process anything about that spot or about that picture, but it's to keep you from getting distracted by looking around a little too much. When we do this exercise that I'm going to lead you through, you want to be in a comfortable position. So that could be sitting back in your chair, feet flat on the floor. It could be in a recliner. It could be laying down if you would like for it to be. The really cool thing about this exercise is some people will use it at night before they go to sleep or to kind of start their bedtime routine, which is great. The really cool thing you're going to see about mindfulness here in a little bit is it can be used literally anywhere and pretty much at any time. So I've taught clients how to use mindfulness as they're walking through a crowded store, as they're training their dog, as they're driving down the highway. So it doesn't always have to be this big, long exercise I'm going to walk you through today. I just want you to get the full picture of what it can be and what it can feel like. Okay. If you experience any intrusive thoughts, so thoughts that are not wanted or thoughts that are not intentional and they are distracting to you while you're doing the exercise, I want to give you a couple of visualizations that you can do. So one is you can picture leaves floating down a stream, and each of those intrusive thoughts, you're going to put on one of those leaves and you're going to let it float away. You're going to watch it just wash down the river. Okay. And you can keep doing that until those intrusive thoughts are eliminated. Another option that's a visualization is a hot air balloon. So you picture a hot air balloon, you're placing a thought on that hot air balloon, and you're allowing it to float away as we're going through the exercise. You can also come back to the sensations in your body. So come back to noticing what is present in your body, and that's another really great way to ground yourself. You could even like stroke the fabric of your shirt or your pants, right? Your hair. Some people like to use their hair. Or it may even be a fidget that you have. Those are all acceptable. Okay. As I mentioned earlier, we are going to be noticing our bodily sensations. You may notice or feel something very easily. You may feel like it's kind of difficult for you to notice something. Um, or you may not notice or feel anything in your body at all. And that's what we call kind of a numbness. And that is okay. It doesn't mean that you're doing anything wrong. So do not jump into that judgmental thought. I'm not doing this right. I can't get it right. If you're experiencing numbness, it just means that's where you're at today and that's where your body is at today. So, I would encourage you to just notice. I don't really feel anything there at all. That's totally fine. You're still noticing and you're still in mindfulness. So that is no worries at all. Lastly, when you do this exercise, when I do it with clients, a lot of times I like to have something, I use essential oils. I like to have a fragrance that they can smell. So I might put something like on a cotton ball or a candle, something like that, that they can hold up and smell, because I will ask you to implement your sense of smell as well as your sense of taste. So that could be a candy of some kind. It could be whatever works for you. You know, you obviously don't, I mean, there is such a thing as mindful eating. We're not going to go through that today. I'm not going to walk you through, eating a whole mindful meal. But just having something that you can taste, take a lick or two of, or chew some gum, for example, those all work. All right. Okay. So we're going to walk through this today. So we're going to get in our comfortable position. All right. I'm going to close my eyes. And I'm just going to take a few moments to notice what I feel in my body. Does my body feel hot or cool? Does it feel tense or relaxed? Does my clothing feel soft or rough? Is there any pain in my body? And I'm also going to ask you to notice your natural breath. Does your breath feel slow or fast, shallow or deep? Notice your breath as you rise and fall as you breathe in. Next, you're going to place your hands on your stomach. I'm going to take a deep breath in, count to 5, and breathe out through your mouth. Breathe in through your nose, count to 5, out through your mouth. And we'll do one more breath in and then out. If there are any distracting thoughts at any time, I want you to picture leaves on a stream or hot air balloons. Place your thought on one of those items and allow it to float away. The other option is you can use your bodily sensations to come back to the moment and just notice what is present. So we're going to start with our toes. So we're going to focus from our toes to our knees. So what we're going to do is we're going to slowly curl our toes and tighten our toes and our calves to our knees. All right. So as we tighten, you're going to breathe in, then you're going to hold, and then you're going to slowly breathe out and release. So breathe in and count to 5 and tighten. Hold. 1, 2, 3, 4, 5, and release. 1, 2, 3, 4, 5. When you tighten, you just want that to be a gentle tighten. You don't want it to hurt. You don't want it to be as hard as you can and cause a cramp or increase pain. If there's too much pain there to tighten, then just notice that and do your breaths. Okay? Very flexible. So we're going to do it one more time. Breathe in and tighten and hold, then breathe out and relax. So breathe in, hold, 1, 2, 3, 4, 5, and relax and breathe out. So we're just going to take a moment to notice from our toes to our knees. Does our body feel warm or cool, tense or relaxed? Does our clothing feel soft or rough? Does our clothing feel tight or loose? Any pains or twinges between our toes to our knees? Next, we're going to tighten from our knees all the way up to our buttocks, our glutes. We're going to do the same thing. Breathe in and tighten. Hold and breathe out and relax. Breathe in and tighten. Hold. 1, 2, 3, 4, 5. Breathe out and relax. So from our knees to our waist, through our hips, does our body feel tight or loose, which would be tense or relaxed? Does our body feel warm or cool? Does our clothing feel soft or rough? Does our clothing feel tight? Does it feel snug or loose? Any pains or twinges from our knees up to our waist? Just notice what is present without judgment. So you might say, I notice there is tension in my back, or I'm worried about the pain in my knee. We're just noticing what is there right in this moment. Now we're going to tighten from our waist all the way up to our shoulders. So up through our stomach, up along our spine, to the base of our neck. Okay. So we're going to breathe in slowly and tighten. Hold. 1, 2, 3, 4, 5, and relax. Breathe in and tighten. Hold. 1, 2, 3, 4, 5, and relax and breathe out. Notice, does our body feel warm or cool from our waist to our shoulders? Does our body feel tense or relaxed? Does our clothing feel soft or rough? Does our clothing feel snug or loose? Any pains or twinges from our waist up to our shoulders? Next, we're going to tighten from our shoulders, down through our biceps, down through our forearms, to our wrists and our fingers. So as you tighten in this one, you might slowly curl your hands into a fist. And then when we breathe out, slowly uncurl until they're fully extended, your fingers. Okay? So we're going to go ahead and breathe in and tighten and hold and breathe out. Breathe in and tighten and hold and breathe out and relax. Next, we're going to notice, does our body from our shoulders to our elbows to our fingertips, does our body feel warm or cool, tense or relaxed? Does our clothing feel snug or loose? Does our clothing feel soft or rough? Just noticing what is present. Are there any pains or twinges from our shoulders to our elbows to our fingertips? Next, we're going to tighten up our neck, across the back of our head and our face. So your face might be scrunchy and look funny, and that's okay. All right. So we're going to take a few moments to go ahead and breathe in and tighten. Hold. Breathe out and relax. Breathe in and tighten. Hold. Breathe out and relax. Noticing from our neck, up the back of our head and down our face. Does our body feel warm or cool, tense, relaxed? Any pains or twinges? At this point, you can take a few moments to notice the sounds that you hear. It may be the sound of my voice. It may be the sound of a clock or a TV or a voice in another room. It may be the sound of your stomach or your own breathing. Just noticing what you can with your hearing. Next, take a few moments to notice what you can with your sense of smell. So you might not notice any smells at all. You might notice a fragrance from your laundry softener or your perfume or hair product. There might be a pleasant smell, like something baking. There might be an unpleasant smell, or you might not notice any smells at all, and that's okay too. Just take a few moments to notice what you can by what you smell. Now we're going to notice what we can taste. So if you wanted to have a piece of candy or some gum, or maybe there's an aftertaste to a soda, you could use a drink right now if you wanted to. Or you might not notice any taste at all, and that's okay. But we're just going to take a few moments to notice what we can with our sense of taste. Now we're going to do one more body tense and release as a full body, and then a full body scan from our toes all the way up to our head. So we're going to go ahead and tense our body all at once as we breathe in, hold, then slowly relax and breathe out. So we're going to go ahead and tense and breathe in, hold, 1, 2, 3, 4, 5, and relax. One more time, breathe in and hold as we tense. Hold, 2, 3, 4, 5, and breathe out. So now we're just going to take a few moments to notice from our toes all the way up through our waist to our shoulders, down our arms to our fingertips, and up to the very top of our head. Does our body feel warm or cool, tense or relaxed? Does our clothing feel tight or loose? Does our clothing feel soft or rough? Any pains or twinges that are present from our toes to our knees, up to our hips, up our back to our shoulders, down to our elbows, to our fingertips, up our neck, across our head, and down our face. Just take a few moments to notice what is present. Maybe even notice how you feel now compared to where you started. I'm now going to count back from 5 to 1. And at any time, you're welcome to open your eyes or readjust your vision to kind of rejoin the room. Maybe in 5, maybe in 4, maybe in 3, maybe in 2, maybe in one. All right. So that is kind of a combo exercise that I do with a lot of my clients. It combines the mindfulness, noticing what is present in the moment, utilizing thoughts, bodily sensations, right? And emotions. We also did progressive muscle relaxation, which is the tension and release of different muscle groups. And we did our deep breathing. Okay. So the next big question of the day, Bonnie, how does this apply to training? Or how does this apply to working with my service dog? So, as I mentioned once before, and we're all pretty well versed, dogs can sense our emotional states and may feed off of our emotions, right? Some ways that we could use our dogs to help us engage in mindfulness. We could count our dog's breath, count as their rib cage rises and falls, or if they're panting, how many pants are they doing in a certain amount of time? How many steps are they taking? We can also notice the color of objects, right, as we pass by. So, how many red objects do I see in the next 10 steps if we're in a store? Um, we can use our dog for mindfulness and focus. So, we could, for example, work to match our breath to theirs, right? We could work to, if your dog is comfortable with eye contact, making eye contact. We could take a moment to really notice the texture of their coat throughout their body by petting them and exploring the different textures throughout their body, noticing the different shades of color in their coat. Because oftentimes there's some variations in there, or even in their eyes, right? So those are all ways that we can implement our dogs as a tool to engage us in mindfulness. Okay. Mindfulness also comes into play by helping us be aware in the present moment without judgment. So, our dog's behavior may raise our stress level, our anxiety, or possibly even our pain if they yank on the leash or they jerk on our wheelchair, right? So, by being aware in the moment of where we're at emotionally and that our dog may be struggling, that allows us to intervene in a helpful way for our dogs and for ourselves. And if we learn to know our dogs well enough and to know their signals, we can intervene even earlier, right? Which reduces everybody's stress and provides a much more positive outcome. It also allows us to ask the question, what is their need in the moment? So if our dog seems to be really frustrated, if they're kind of turning a deaf ear to us, right? Typically, that's a sign that they're maybe a little anxious or distracted. So they're excitable or they're stressed or anxious, however you want to say that or whatever it may be. We're not going to label that good or bad. My dog is being so stubborn right now. My dog's being a little jerk right now. My dog's just wanting to be difficult today, right? It's my dog is having a hard time in this situation. How can I best assist them? All right. So again, it's taking out that judgment and just acknowledging my dog is really having a hard time following my instructions, and that's frustrating me. That's a very valid, non-judgmental statement. It's acknowledging what is present. It's acknowledging our emotional state. That's totally fine and totally normal and healthy to do, right? It allows us to be proactive. So the more we implement mindfulness, typically the more we can be proactive by we raise our awareness of potential triggers in our current environment that may be triggers for ourselves as well as our dogs. It helps us become more tuned to our dog's body language, our specific dog's body language, and when and how to support them. So, different techniques and different strategies may work for different dogs in supporting their stress level or reducing their excitability, reducing their frustration, how fast this dog can train on a specific task, or how quickly they learn on this task in public versus at home. Mindfulness is really, noticing all of those things. And the more we practice it, the more aware we become, not in an anxious, like paranoia kind of way, but just a more attuned and an attuned way to our environment, ourselves, and our dogs. All right. Also, being mindful of your state. So, your emotional state. Is today or is right now a good time for me to train? Am I in a good frame of mind to be training my dog? Is today a good day for me to train my dog something new? Do I have the energy? Do I have the patience? Do I have the mindset? Am I able to focus and be positive and relaxed? What's my pain level like? Do I need to work on something that doesn't involve me holding on to my dog? For example, maybe I need to be more hands-free if my shoulders are hurting. Um, Am I excited? Am I frustrated? Our dogs are going to feed off of that. And then if we're super excited or we're maybe kind of in a high excitability state, then and we're trying to work with our dog on stay or settle or something that requires calming, that may not be a good match, right? So we may want to either help ourselves get into that calmer state, or may want to train on things that require a higher drive or a higher energy level from our dog in that moment if we can kind of be, what I want to say, like kind of co-regulating at the same energy level, right? Um, so you being calm will help your dog bring down their energy level. If you're excitable, that typically is going to raise their arousal, whether that's excitability, whether that's stress, whatever that may be for your dog. It helps us be prepared. So when we think ahead, it helps us be prepared with our supplies. It helps us be prepared of what kind of questions or comments people may ask about our dog being a service dog, the breed of our dog, where we got our dog, what we're doing while we're training, questions and comments that will come from businesses, from our medical providers, from the public, right? So mindfulness kind of allows us to picture ourselves in some of those scenarios and just be prepared for those. It doesn't mean we have to go through every what if and get ourselves all anxious and worked up about it, but it helps us be attuned to what feelings may arise in those moments and how do we effectively manage that for ourselves and our dogs in a way that is satisfactory for us. Okay. So I hope that you guys have found this to be helpful and interesting. I'm excited to hear how and when you're able and willing to implement this technique. I tell people, if you do this once or twice a day, then, and you do it for like a month or so, instead of it taking 15, 20, 30 minutes, oftentimes you'll be able to notice those sensations in your body much earlier in the process rather than waiting until you're super stressed out and you're having shortness of breath and your muscles hurt really bad. What I noticed was I could notice my muscle tension in my shoulders much earlier in the process. And I trained my body that as I took deep breaths, those muscles were to relax. So instead of having to do 30 minutes to get that muscle relaxation, it would happen instantaneously. So that I would feel a little bit of tension. I take a couple deep breaths and focus on that muscle group, and my muscles would just melt. So there is a benefit to putting it into practice on a daily basis, or even twice a day, if you're willing and have the time and are able. Everybody's at a different readiness point, so just do what you can do and work on growing it from there. All right. So we will wrap up. We will wrap up there, and I hope that everybody enjoyed that and finds it helpful.
Thank you very much. I think it's going to be wonderful for our symposium. Get people thinking kind of in a different mindset for our day one, where we're looking at the emotional side of that for both human and dog, but the emotional side of it being a service dog handler is our big day one presentations. So we
Yeah.
hope that you enjoyed this one, and there are two more for day one that you can listen to. And our live panel is at 6 p.m. Central Daylight Time today. So thank you very much. Everybody have a great day.